He can't run when we play tennis. It gets me really sad.
Oh, I am definitely broken.
It's like living with an older man. My dad's more active than Matt is and in a lot less pain.
Sometimes I feel like, oh, this hurts, and I realize, hey, I shouldn't be complaining because my dad has to go through this constantly.
In a healthy functioning hip, there's a certain degree of cartilage, which is lubricant, which allows your bones to rotate without hitting each other. And my cartilage is worn away completely on the inside. So the bones actually start grinding against each other, and it hurts. Let's go, Jacob.
The man I married was biking, swimming, doing triathlons, doing marathons. We were out active all the time, and we can't do any of that.
Most athletes don't look for sympathy. His self-esteem and a lot of his ego was built upon the activities that he did with a passion for such a long period of time. And when you lose that, you lose a part of yourself.
One of the worst is when I'm teaching a fall in front of a group of high school kids, which is humiliating. It makes you feel old and incompetent.
He had to give up surfing a while ago, and that's been really, really hard for him.
This winter, I surfed one day, and I could not move afterwards. I went to the doctor, and he said, you know, you got the hip of a 65, 70-year-old man. The things that I loved are being taken away.
Matt developed arthritis in his hip, and right now the best option would be a hip replacement surgery.
Oh, good, good. We've been waiting for you guys. How are you? Nice to see you. My name's Mary Margaret. I'm one of the nurses here. I'm gonna help you.
My first reaction was, I'm never going to have, hip replacement surgery. I mean, that's a very, I think, normal reaction when you're in your 40s. But the pain that I have is the advanced form, so I just decided to do it.
In Matt's case, he didn't have any large trauma to his hip. He never dislocated it. He doesn't have any problems with vascular disease. It's just a genetic predisposition. Everything's set up downstairs.
He is exactly who you want as a doctor. He looks at my x-rays and he goes, you're in a lot of pain. You need a hip replacement. He's very confident, and I went, wow, I'm in the right hands.
He really needs to have this done. We had to drive pain pills to school for him yesterday because he was in so much pain.
I'm just kind of overwhelmed.
Hey, you guys want to see the
Yeah.
show?
Yeah, you know what? That's normal. That's normal. We're going to take very good care of you.
I love you. It's fine. This is a good thing, so.
Don't worry. Just take a nice nap.
What we want to do is put an artificial hip in exactly the same position as the natural hip, using a minimally invasive 2-incision technique. Through the front of the joint, we split the muscle and put the socket in. And through a small incision in the back, and we're able to put the stem in. The advantage of this approach is that you have a very stable hip, and the risk of dislocation is very, very small. Using the navigation system, we're able to tell where our implants are going within a degree. Just making sure the stem's straight. It looks perfect. When I'm putting the socket component in, I'll actually see on the screen the computer-generated image of that socket. Right now, we're going to find the center rotation of the hip. It's telling us that we've just brought him down a millimeter or two, so we basically reproduced his anatomy. And everything looks good.
Oh, he is beautiful.
1, 2, 3. Cookies. One more. Happy birthday, dear Dad.
I'm completely, utterly without pain for the first time in 5 or 6 years. If it was miraculous, that would mean I'm the only one, but I think that this is how it works. I feel better. Surfing, first time I paddled out, I just paddled in the ocean. And then the next weekend did better. And then last weekend, the surf was big, and I could surf, and surf pain-free. I'm back. I'm definitely back. Every time I walk up the hill from Blacks, that's when I realize how healthy I am. I'm walking up the hill, there's no pain.